I'm Joe Messino. I'm a nutritionist. I've been doing this with physicians, working with physicians, training, educating for about the last 20 years. And we concentrate on natural health, age management. We don't say anti-aging anymore. We say age management. All right? We don't want to get that bad term in there, anti-aging. Because you got to age, right? But you don't have to get old. And one of the key organs that determines aging is the brain, right? Age-related brain disorders are on the rise. Is anybody surprised by that? I mean, are you surprised that anything is on the rise? I mean, we know heart disease is on the rise. It's still the number one problem. Even though back in 1980, okay, the National Heart Association came out in print and said, if we eliminate fat from our diet and everybody goes on a statin drug, we'll eliminate heart disease by the year 2000. Now you can find that, Google it, it's in print. Well, it's 2015. 15 years after their deadline. Did they eradicate heart disease? Still the number one killer. They eliminated fat from our diets. And what did that cause? Rise in brain neurodegenerative diseases. Because fat feeds the brain. When you eliminate essential fats from your diet, including saturated fats, they are not bad. Saturated fats got a bad rap years ago because they wanted to sell you margarine. And they wanted to put hydrogenated oils in all foods so they could preserve them, do it cheaply, and cause havoc with your health. Fat is not the enemy, never was. Now we're finally able to show that again. So, let's start talking a little bit about one of the key nutrients that has been depleted from us because of what's been going on in our healthcare system. And you know, I like to let you have to understand that there are reasons why these things have gone wrong, okay? You always got to look to the reason why. Not who, not where, not what, but why. And usually why leads you to that statement, always follow the money, right? So CoQ10, an essential nutrient for life, not just health, life. Every cell in your body needs coenzyme Q10. It was discovered way back in 1957. Okay? They were studying cow hearts and they found all of this stuff. They wanted to see what was making energy, and they found this yellow substance, and they named it ubiquinone because it was everywhere in every cell of the body. That's what ubiquinone comes from, ubiquitous, which means everywhere. It's also called one of the super antioxidants. Thank you, Michael. And there's a reason for that. There's 5 of them. CoQ10, vitamin C, vitamin E, alpha-lipoic acid, and glutathione. Okay? Now, your body doesn't make vitamin C. Okay? It can synthesize alpha-lipoic from some things, but you have to get them mostly from nutritional supplementation. Why are they the super antioxidants? Because they regenerate each other. What does an antioxidant do? It repairs a free radical cell. Okay? A free radical cell is a cell that's lost an electron and now is a scavenger trying to make itself whole again, and that's what causes that whole chain of events called free radical damage, which is the beginning of all degenerative diseases. So antioxidants stop that, and the super antioxidants, those 5, they help regenerate each other to stop that chain of events. Sure. CoQ10, alpha-lipoic acid, vitamins C and E, and glutathione. Glutathione is the body's master antioxidant. You make glutathione. Actually, vitamin C is one of the components of making glutathione, along with N-acetylcysteine, which is another amino acid, essential amino acid. Okay? The highest levels of CoQ10 are found in the heart, lungs, liver, and brain. Okay? Highest levels. Why? What's it responsible for? Energy. Transporting ATP, energy. What organs use the most energy? The ones that don't stop working. Heart never stops. Lungs, you got to breathe. Your liver is way overworked. And our brain. I mean, look at this now. You can replace a heart. You can even do a lung transplant. Liver. You can't replace a brain yet. Okay? Yet. Even though it would be good if we could replace a few brains. But no, Dr. Frankenstein's dream has not come true yet. So we have to take care of the brain. You know, I've been doing this, like I said, for 20 years. And early on, when I'd go into doctors' offices, if they were receptive, it was a little easier. If they were, on the fence, then I always got this question. Show me the studies. Show me the science. Where's the science that says this stuff works? Well, depending on my relationship with that particular physician, this is how I would answer it. Gee, doc, you mean the science that approved drugs like Vioxx? Killed 60,000 people? How about Fen-Phen? How about Celebrex? How about all these other drugs that have killed hundreds of thousands of people being used correctly? If those are the kind of studies you want that approve those kind of drugs that killed thousands of people, I don't have them. Because we haven't killed anybody yet. Not yet. There is more than 4,000 scientific studies on CoQ10. So there's the other answer to that question. Is it studied? Yes. Is it one of the most studied nutrients of all time? Yes. The next one I'm going to talk about that's right up in that list is coming later in the presentation. But CoQ10 has been studied for years and years. Disease prevention, slowing down the aging process, heart disease, hypertension, energy, vitality, these are all related. Okay? Improvement in brain disorders, including Parkinson's. Were any of you here at the last Wellness Week in December? Anybody here? Did any of you see my presentation? Did you see the patient that we brought in? Okay. Let me tell you what happened. Last time I did this presentation, she couldn't be here today, but my aunt was diagnosed with Parkinson's 19 years ago. She is now 70 years old. She's the picture of health. We brought her in here to show you living proof that natural remedies work. Because 15 years ago, we put her on a protocol of 1,200 milligrams of CoQ10 per day, 4 grams of omega-3s per day. She got glutathione from a compounding pharmacy because it's very hard to absorb orally. And that was her protocol until about 6 years ago when we added DMG. I was going to say damn mighty good. DMG, that's our nickname for it, dimethylglycine, to that protocol. And to this day, she is symptom-free. Symptom-free. The key to that protocol was the CoQ10. That's the number one. That's the thing she never goes without. And she stood up here and told and showed everybody that it was true. Okay? So it works. 1,200 milligrams. Right. That's the protocol for brain-related disorders. I'm going to show you how easy that is in a little bit. So as I said, the history of CoQ10, it's got a long, long history. Dates back to 1957. They've been studying it for years, many MDs. You don't have to worry about remembering this. You're going to get the handout. You'll get the presentation, so you'll have this information. I put it on here because I want you to see the history. I want you to see how this developed. That this is not a flash in the pan. This is not just the sexy nutrient for 2015, because CoQ10 goes back to 1972. It's been around a long time. It's been studied a long time, and it's proven to work. Here's something you want to remember. CoQ10 is a major mechanism in the biochemical energy process and absolutely essential for life. Why? Because when a cell doesn't get energy, the cell dies. When the cell dies, you start a chain reaction of cellular death, which inevitably leads to your death. This guy, he's been here before. You know, he knows the answers to a lot of these questions. Essential for life. Folks, there are there's few nutrients out there that I would say to someone, make this part of your daily routine, regardless of anything else. CoQ10 is one of them. It's that important. We used to say, years ago, it was the number one nutrient to take. I still think it is. There's a lot that go with it, but you can't live without it, and you cannot get it from food. You cannot get it from food. You have to eat I think it was 3 or 4 pounds of peanut butter, and about tons of meat. I mean, it just goes on and on and on. You can't do it. Like most nutrients today, you can't get it from food in therapeutic levels. Could you get a tiny amount from food? Sure, but not therapeutically. Our lifestyle has led us to this point where we must supplement. Supplementation never takes the place of food. It does exactly what it's called. It supplements it. But it's necessary. If you want to practice age management, if you want to age without getting old, then you must supplement your diet. Oh, here it is. You need a pound of sardines. Anybody ever ate a pound of sardines in one sitting? I like sardines. I get those little cans. What are they, 4 ounces? Maybe not even that much. Okay, 2 pounds of organic beef, chicken, and pork hearts, and 2.5 pounds of peanuts. Pounds of peanuts. Can't do it. You can't do it. And it would only give you 30 milligrams, and that's not a therapeutic dose. Okay? All right, so you're convinced you have to supplement with CoQ10. Why are we deficient? There's a lot of reasons, okay? Your body actually makes CoQ10, right? It is a nutrient that's indigenous to your body. You make it every single day. You make it in your liver, and you make it in the same pathway as that other vital nutrient, which is? Nope. CoQ10 is made in the exact same chemical pathway as cholesterol. Uh-oh, light bulb went off. You didn't read ahead. See, if you'd have read ahead and saw this, you would have found it, right? So it does drop after you start aging. After age 20, age 40, age 50, you start making less and less of it. Extreme physical exertion will deplete CoQ10. Hyperthyroidism will deplete CoQ10. And, of course, since it's made in the same pathway as cholesterol, if you take a cholesterol-lowering drug, which stops the production of cholesterol in that pathway, it also stops the production of CoQ10. So, remember I said earlier, go back to the question, why? Why do we have a problem with heart disease? Why do we have a problem with neurodegenerative diseases? Why are they escalating? Because what's been the number one drug prescribed in this country for the last 30 years? Statins. That has contributed directly to the rise in these other diseases. I told you about the other four that make up the super antioxidants. Okay, and CoQ10 is important because it works inside the mitochondria. That's the cell, the powerhouse. That's the engine room of your cell. Okay, that's why it's so important. CoQ10 gets there. It gets into the nucleus. Okay, it's a fat-soluble nutrient. For years, you had to take CoQ10 with some sort of food that was fatty. Peanut butter, something, anything. Or you had to get it in a soft gel format. You don't anymore because we've been able, technology has helped us here, to make a form of CoQ10 in a chewable tablet. And that changed everything because then it became water miscible, not water soluble, water miscible, which means the transport mechanism, being your saliva, was able to get it into the cell in a chewable format. I would not take CoQ10 in a powder in a capsule, but in a chewable format, you get the conversion. So you don't need the soft gel. The chewable is the best for absorption. Okay, so we talked about growing old as opposed to aging, right? I think energy decline is probably a big factor, right? In feeling old. How do you feel? That's the key. I work with a lot of hormone replacement therapy physicians, natural hormone replacement therapy physicians. And one of the things I learned from them, I use the word learn, but actually I stole from them. I always steal from the best. I was taught that a long time ago. But one of the things I learned is that here's the problem with most traditional, I don't even like that word, allopathic, or let's say medical school trained physicians. They've gotten into the habit of doing one bad thing that causes all the other problems. They treat the lab and not the person. You get lab results back and they say, oh, your cholesterol is high here. They say, well, how do you feel? What's your energy level? How do you feel? Because you go on a statin and you feel worse because you've stopped the energy producing nutrient CoQ10. What are the major symptoms of the statin drugs? Pain, muscle soreness, leg fatigue, foggy brain. What are the biggest muscles in your body? Legs. They're going to be fatigued and you're going to get pain. What's one of those 4 or 5 organs that uses the most CoQ10? The brain. Brain fog. Look out. What feeds your brain? Cholesterol. Uh-oh. Simple, isn't it? Simple, not easy. That's another one I stole. I'll tell you where I got that one. Pat Riley, coach of the Los Angeles Lakers, just won his 3rd championship, and a reporter said to him, Coach, you made it look simple. He said it was. Just wasn't easy. This is all simple. Application is sometimes very difficult. Let's talk about Parkinson's a little bit more. Caused by a combination of biochemical defects, including free radical damage, which we talked about earlier, and mitochondrial DNA mutation that destroys brain cells that are responsible for dopamine production, a neurotransmitter called dopamine. This enables people to move normally. Did anybody see that movie with Robin Williams and Robert De Niro, where he was the patient and Robin Williams was the physician? That was based on a true story, and it was all about the neurotransmitter dopamine. Now, they were doing it with a drug, but even so, they were getting that message out there. Energy consumption plays a large part in the progression of this disease because you're robbing that energy from the brain. This is actual research. Massachusetts General Hospital. The study demonstrated that CoQ10 protects against excitotoxicity. That's the degradation of energy, losing energy, levels of nerve cells leading to cellular death. It's there. It's in there. It's not just an opinion, folks. This is actual studies that prove beyond a shadow of a doubt what's going on in our bodies. Okay, these are directly related to the blood levels of CoQ10 in these patients. When they supplemented with CoQ10, they restored energy and alleviated the symptoms. I promised you breaking news. I'm going to give it to you right now. Curcumin. A lot of us have heard of it. Turmeric is the spice that it comes from. Okay, curcumin is the active ingredient. Curcumin has been used as an anti-inflammatory, right? We use it as an anti-inflammatory. One of the places you can get curcumin is in X-Flame. It's one of the key components of X-Flame for its anti-inflammatory properties. Many people are using it as their natural pain reliever. It's that good. Okay? So curcumin, it's a bioactive ingredient in turmeric, and it's capable of crossing the blood-brain barrier, which is why it's now part of this protocol for brain health. Not all nutrients do. Turmeric or curcumin does. So that makes it neuroprotective. That means it's going to protect the brain. What is that lining around the brain? What's it called? Myelin sheath. Okay? It's fat soluble. Okay? To get through it, you need nutrients that can. Recent research shows a bioactive compound in turmeric called aromatic turmerone. This increases stem cell growth. Stem cells, have you heard of those? Those are the cells of life. They are actually doing stem cell transplants now. I know a veterinarian in Pittsburgh. His name is Dr. Mike Hutchinson. He's out in the North Hills at Animal General. He is the world's, not the states, not the countries, the world's leading surgeon for dogs and cats using stem cell therapy. He's taking 16-year-old dogs and turning them into puppies because he's improving their legs, their hips, their joints using stem cell therapy. Well, curcumin enables you to increase your own stem cell growth. So now it's going to be a key component in recovery of brain function. Okay? Recovery of brain function, it will affect everything from Alzheimer's, Parkinson's, dementia, and just plain old brain aging.
It's a spice.
It comes from a spice.
Turmeric.
Yes.
The Indians
Eat a lot of curry, right?
love curry.
That's right.
My mother was
Protects their
Italian,
brains.
used to feed us curry all the time.
Mm-hmm. Yeah, exactly. You can find it in diets, and you can see in the people that have those diets the difference in their brain health. Okay? So let's go back to CoQ10 for a second. So we're going to add curcumin. We need to add curcumin to our protocol of CoQ10, dimethylglycine, and omega-3s. Okay? Good omega-3s. Other benefits of CoQ10 besides the brain, gum disease. Did you know that? If you chew CoQ10, chew it in a chewable tablet, and let it, swish it around in your mouth before you swallow it, it actually is shown to improve gum disease. Okay? Why? Anybody have a guess? Free radical damage. Gum disease is free radical damage at the surface. Okay? Starts at the cellular level, comes to the surface. So now we can treat it with CoQ10. Your immune system. It increases all of the good stuff. Macrophage, killer cell, interferon, all of your body's natural immune defense systems. We've seen tumor regression in cancer patients, normalizes insulin levels, anything related to the heart. See, the thing with the statin drugs, why they have increased heart disease in this country, okay? They sought to eliminate it, they actually increased it. One simple reason. You don't have to be a neuroscientist to understand this. They just contributed to the very disease they were trying to stop. Why? There's that question. Why? Because they cut off the nutrient that the heart needs the most. CoQ10. Statin drugs stop the production of it. The heart doesn't get it. The muscle weakens. Heart disease goes up. Oh, did their cholesterol levels go down? Yeah, but they had heart attacks because the heart muscle couldn't work. Forget cholesterol meds. The biggest medical myth we've ever seen in this country, I say that every darn time. Forget them. You don't need them. And I'll tell you something else about cholesterol. Unless you are one of the 1% of the entire population that suffers from congenital hypercholesterolemia, an actual disorder, gene-related, where you do make too much cholesterol, unless you're in that 1%, there's not a single person in this room, in this clinic, in this city, in this state, in this country that makes more cholesterol than they need. Not one. You don't make too much. It's not from eggs. It's not from shellfish. It's not from meat. It's not that issue. The issue is your overall health and your vitamin deficiencies and antioxidant deficiencies that don't allow your body to excrete the cholesterol once it's done its job. That's when it hangs around too long. That's when it oxidizes. That's when it forms plaque. It's not because you made too much of it in your liver. So the Band-Aid on the problem doesn't cure the issue.
So do we have to watch how much cholesterol we eat?
No. You do not have to watch how much cholesterol you eat. Dietary cholesterol, this is a proven fact now, does not correlate to blood cholesterol levels. Dietary cholesterol is used by the body as energy. It doesn't form plaque. Trans fats are bad. Artificial fats are bad. Triglyceride levels are far more important than cholesterol levels. Triglyceride levels show actual fat deposits in the blood that come from the consumption of trans fats. Okay? What is a trans fat? Margarine, hydrogenated oils. Anything that has in front of it the word hydrogenated or partially hydrogenated is a trans fat. Anything. Any oil, soybean, corn, canola. Has anybody ever seen a canola? Anybody? No. Because there is no such thing as a canola. So when we talk about eating whole foods in their natural state, there's olives, right? We have olive oil. There's coconuts, we have coconut oil. There's no canolas. But it's been used forever, even in so-called health circles, as a healthy fat, healthy oil. It's not. It comes from something called a rapeseed, and it's toxic until it's refined to the point where the toxicity is removed. You know what canola stands for? It's combining Canadian oil. It comes from Canada. Canada oil, canola. It's not a thing. Don't eat it. How much CoQ10 do you need? I'm sorry. I do get off tangent every once in a while. How much do you need to take? Well, general health, 100 milligrams a day. General health. That's for people that are in good health, good cardiovascular health, good weight, good brain health. 100 milligrams should be a staple in your supplement regimen every day. Heart disease prevention, you got to double that. You got to go up to 200 milligrams. Statin use, you got to do that. You got to double it again. You got to get up to 400 milligrams if you've been on or are currently on a statin. And even if you've gone off of them, the damage is done. Double that amount. And I told you about a brain disorder. For prevention, 400 to 600 milligrams a day. Brain disorder treatment, 600 to 1,200 milligrams if the disease has already set in. You got to get from 600 to 1,200 a day. How in the world are you going to do that? Simple. I made it easy. This particular product, Power Q600, each chewable tablet has 300 milligrams of CoQ10 and 300 milligrams of DMG. Damn mighty good dimethylglycine. Each tablet. So if you chew 4 of these a day, you're at 1,200 of both nutrients. That's easy to do, isn't it? Right? They're easy. They're chewable. Nothing to swallow. Don't even have to take them with food. Why? Because you chew them, you turn them into a liquid, water miscible, doesn't require digestion. The reason you take most nutrients in capsule and tablet form with food is because you want your body in the digestive process to assimilate them. But when you're chewing them and it forms a liquid, you don't have to have it with food. Power Q600.
That's all the neurodegenerative?
Yes, all neurodegenerative problems. Exactly.
Can I give it to my cat?
Yes. Absolutely. Okay, let's talk a little bit more about DMG, okay, just a little bit. When you add DMG to CoQ10, you take the delivery method of those nutrients and you send them into hyperdrive, okay? Because DMG creates an oxygenated environment in the cell. That means anything that's taken with DMG is now fortified, getting into the cell easier and more efficiently. Guys, remember, I don't know, do they still make STP for your gas? Yeah, okay. So what does it do? It improves it, right? This is what DMG does to any nutrient you combine it with. It improves its absorbability and its effectiveness. Okay? So that Power Q600, the ultimate CoQ10 formula, 300 milligrams of each, 4 tablets a day, will give you powerful disease prevention capabilities. Okay. Any questions? By the way, curcumin. Okay, yes, it's in X-Flame. You can get it by itself, but it's in one of our primary hormone replacement therapy nutrients. Okay, bioidentical, natural hormone replacement, EstroCleanse. I just want to tell you about this for a second because I love this formula. I take it. Okay, EstroCleanse combines diindolylmethane, DIM, which comes from cruciferous vegetables, indole 3-carbinol, also from cruciferous vegetables. But it also has things like resveratrol, wasabi, and it has curcumin in it, okay? In fact, a very nice amount of curcumin, 600 milligrams per dose. Okay, so you can get your curcumin and get the benefit or the positive side effect, the PSE. Now that one I didn't steal, that one is mine, I made that one up. A PSE is a positive side effect. The PSE is for EstroCleanse, and you will naturally balance the ratio of free testosterone to estrogen in your body. That's what DIM, D-I-M, does naturally, okay? And that's the problem as we age, is keeping that delicate balance. Okay? We're not trying to raise one or lower the other. We want that ratio to stay where it's supposed to stay, and DIM does that. But the PSE of EstroCleanse is you get 600 milligrams of curcumin as well a day. Okay, so that's one way to get double for your money. Yes?
You said something about cruciferous,
That's where DIM comes from.
but standard process has cruciferous complete.
Yes, but you have to look at the level of DIM that's in that, unless they don't tell you what that level is. A lot of their products, you don't get the actual, they're whole food based, they're good products, but to get therapeutic levels, they're sometimes too low. But DIM comes, you can't eat enough Brussels sprouts, broccoli, cauliflower to get enough DIM to make a difference in your hormone levels. Okay, you can't. It's impossible. You can't get it because usually we start at a place where we're way behind the 8 ball to begin with once we start on this. But you can, I'm not saying don't eat them. I love them. My recipe for Brussels will knock your socks off. But you got to get DIM from a supplement to get a therapeutic result. Yes?
Is the EstroCleanse both for men and women?
It's for men and women.
So,
Yes.
is there such a thing as cumin?
Why are you stuck on this cumin thing? Yes, cumin is a spice, but it's not curcumin. There's 2 different things. It's 2 different things. Turmeric is a spice. Cumin is a spice. Curcumin is the active ingredient in turmeric. Okay. Any other questions? Yes, sir.
Q10 in capsules, you say you don't.
If it's a powder in a capsule, it's not going to get you a benefit. If it's a soft gel, okay. Yeah, that's okay. Because the gel, the oil, is a fat. So that helps the absorption of CoQ10. Tablets?
Yeah, I think,
Which ones?
CoQ10.
Chewables?
No, just capsules.
No, I'm not saying it's not helping, but you're not going to get as much absorption of the CoQ10 in a capsule format. You need to get it in either a chewable or a soft gel. Okay? Yes?
Would that S2 cleanse lower like the DHT level from drinking out of plastic water bottles?
What it does is not necessarily lower DHT levels that are caused by environmental sources, but what it will do is allow the proliferation of free testosterone. Once your free testosterone is up, not your total test, but your free testosterone, DHT is lowered. Okay?
Did you say chewable or capsule?
Chewable or soft gel only, yes. Any other questions? Yes, sir.
You said some of that stuff works on cancer, like tumors.
Yeah, CoQ10 does, absolutely. So does DMG.
What about lymph cancer? That's another.
It's beneficial for all types, for tumor reduction and basically improving the immune system to fight the invader.
What about echinacea?
Different mechanism of action altogether, but also is a good immune response. It's more for preventative than treatment.
Oh, yeah.
Yes, more for preventative than treatment.
What about the Darth Vader?
Can you give it to animals, the CoQ?
Yes. Yes, you can. And DMG too, especially. DMG is great. Mike Gallagher has a doctor who had a patient with a dog that had tumors. They gave it DMG, wiped them out. Yes.
You get that by itself?
You can get it by itself. It's called Enter DMG. It's in either a chewable tablet or liquid. Yes. Any other questions? Yes.
What's your recipe for the Brussels sprouts?
I was gonna say, is that in the handout? You should have that in the handout.
I should, huh? Okay. They're halved and sautéed in coconut oil with a little pancetta, which makes everything better, shallots, and crushed red pepper. Pancetta, it's chopped up bacon, kind of. Yeah.
Pass them out.
Yeah.
He hasn't passed them out.
Yeah, you're late. Where you been?
I gotta do my 75 push-ups.
All right, go pass them out first.
Oh, okay.
Yeah, thanks. Okay, he usually passes out all my flyers for me. He's late today. I'm gonna dock his pay. Okay, so there's my recipe, but I'll tell you one last thing. And well, actually, let's have a little tribute to Leonard Nimoy. Live long and prosper, everybody. But there's a joke that is related to our presentation. Okay, there's this old guy sitting on a park bench, head in his hands, crying, just completely upset. So a young guy comes over, sits next to him. He goes, "Hey, old timer, what's the matter?" He goes, "Are you homeless?" He says, No, I'm not homeless. I have a beautiful home, $1 million home, everything you could think of, all the amenities. It's perfect." And then the young guy says, "Well, gee, do you live by yourself? Or are you alone?" He goes, "No, I have a beautiful young wife. She's 30 years younger than me. She's the best." The young guy says, "Well, old timer, is it what is it? I don't understand. Is it your health?" He goes, "No, look at me." He goes, "I'm in perfect health. My body's in perfect health." And the young guy says, "Well, then what's the problem?" And the old guy says, "I can't remember where I live." Bada bing. Brain health, folks. Brain health is the key to warding off premature aging. Yes?
Red rice yeast that's a statin also.
It's a statin-like, it acts like a statin in your body. Statins are made from red rice yeast.
And you said the statins are not good.
I don't recommend it.
I've taken some red rice yeast
Yes.
sometimes.
It's better than a statin drug, but I don't recommend it. Yes?
You sell Brain Boost. How
Yeah.
does that compare with Coke?
Oh, yeah, it's got a lot of the neurotransmitter designed product ingredients in it. Yeah, so Brain Boost is good, but it doesn't have CoQ10. Yeah. Yes.
What do you use Estro Cleanse for?
Men and women can use it as a beneficial nutrient to keep the balance, the ratio of free testosterone to estrogen normal in their body. Yes. Okay, anything else? All right, folks, thank you very much. Live long and prosper.